Welcome to One-on-One. I'm Steve Adubato. It is our pleasure to introduce Dr. Nicholas Jarmon, who is an orthopedic surgeon, Meridian Health. Good to see you.
Thanks for having me.
Your specialty is shoulders.
Yes, it is.
What's up with the shoulder, by the way? It's complicated, isn't it?
It's a little complicated.
A lot of pieces to it?
A lot of moving parts and all in close proximity to each other.
Now, you do shoulder replacements.
Yes.
Wait a minute. I know about the hip replacement. I know about the knee replacement. Are there more shoulder replacements than there were 10, 15 years ago?
Yeah, it's definitely becoming much more common. Every year there's about 600,000 knees done, 300,000 hips done, only about 60,000 shoulders done. But that's a dramatic increase from even 10 years ago. So it's certainly becoming a more popular surgery as people are starting to learn more about it. There's more surgeons trained in it. So it's certainly becoming more and more common. We don't walk on our hands, so it's never going to be like a hip or knee replacement where we're doing 600,000 a year, but it's certainly becoming more common.
What is it that people should be looking for? I mean, I was telling you before we got on the air, I won't go into detail about my shoulder surgeries. But I mean, people have had shoulder surgeries, but what would cause someone to be a candidate for a shoulder replacement?
The only indication for a shoulder replacement is pain, pain from an arthritic joint. From an arthritic joint? As opposed to a rotator cuff issue, as opposed to a... Exactly, as opposed to a rotator cuff issue or
I told you I had a frozen shoulder. That's not,
exactly.
You're not a candidate to get your shoulder replaced.
Correct.
A frozen shoulder, Georgette just asked me, which means you can't move your arm.
Exactly.
That's what happened to me. I couldn't move it past a certain point. Not a candidate.
No. It's really for shoulder arthritis. Occasionally there's certain types of fractures that we treat with shoulder replacements, but for the most part it's for arthritis, painful arthritic shoulder joint. Okay,
so is it a product of aging? Is this arthritis connected directly with aging, or have you seen it at all ages?
It kind of, we've seen it at multiple ages, and people always ask what causes it. Was it type of exercise, lifestyle I led? More often than not, I think it's a genetic disease. We see people that come to the office, they already had their hips done, their knees done, and then they come in for their shoulders. It's just part of, in certain individuals, unfortunately, it's part of their particular aging process.
What are the things, well, first of all, you brought some visuals in here. Can we get a shot of this, guys? Team? Steve, can you get a shot of it? Okay, describe it. What are we looking at?
So we have two models. This first one here, this is called a standard or an anatomic shoulder replacement. This is what the vast majority of the shoulder replacements will be. And it's just replacing the normal ball and socket. We have a metal ball here and then a plastic socket similar to like you would have a hip replacement. Same idea. The next model is a newer type of design, only been available in the United States for about 10 years. It's called the reverse shoulder.
The reverse shoulder?
Yep. And that was really designed for people that have a specific type of arthritis called rotator cuff tear arthritis or cuff tear arthropathy. These are individuals that have these huge, massive rotator cuff tears that can't be fixed. And then over time, they go on to develop arthritis because of that. And they require a specific type of shoulder replacement, and that's the reverse. We also use that for elderly patients with pretty severe shoulder fractures that can't really be put together.
That's metal?
Correct. That's metal as well as a plastic.
So you go in the airport, what happens?
It might set it off.
Really?
Yeah, it might. You show them your scar, they wand you, and they let you on through.
But here's my question as I look at this. I mean, this feels pretty heavy, right? Plus you got the metal here, right? Describe the healing process once you have the replacement, but also the physical therapy part of it. I'm curious about that.
Okay. So the healing process really entails letting the rotator cuff heal after the surgery. As we do the surgery, we make an incision in the front of the shoulder. We actually have to cut one of the tendons of the rotator cuff to get inside the joint and do all our work. Afterwards, we repair that rotator cuff. And then the rehab is really based upon letting that rotator cuff heal. So it's basically the same rehab as someone that has rotator cuff repair surgery. The components, the ball and socket, are solidly fixed at the time of surgery.
So how long are we talking?
Usually keep people in a sling for about 6 to 8 weeks.
Right. So you immobilize it?
Yeah, for the most part.
6 to 8 weeks?
Yeah. My particular protocol, I start people on what we call passive range of motion. So just using your other arm to lift it, move it in space for about 4 weeks. And then we advance to what we call an active assisted. So kind of walking their arm up the wall, doing what we call table slides, just moving across the table to kind of work on building some gentle strengthening.
Sure.
Then at that 6 to 8 week mark, we come out of the sling and start to use the arm as they normally would, with the caveat they're not doing any heavy lifting. Then at about the 3-month mark, let them start working with some weights.
Are athletes, a certain kind of athletes, who do certain kinds of things, I'm thinking pitchers in baseball, are they more likely to have these kinds of problems?
You know, that's a good question. Is the overhead athlete more likely to develop shoulder arthritis? And generally, I would say no. They're more apt to have shoulder issues, labral tears, rotator cuff issues. But to develop shoulder arthritis, not so much. And it really gets back to we really think a lot of it's just a genetic process. You're just kind of born that way.
You're born with shoulders
you're born with bad cartilage, and it wears out, and you get arthritis.
Really?
Yeah.
And you've seen a lot of ball players. What's your connection? I'm a Yankee fan, so when I heard you had a connection to the Baltimore Orioles,
yes.
Well, what did you do for these guys?
During my fellowship, one component of it, we were the team physician for the Baltimore Orioles. So for 2 seasons, I was one of the physicians for the Baltimore Orioles, which was a great experience. You know, covering the games, you know, going down to spring training, getting out of Baltimore on a snowy February day to go do a couple physicals and.
But you love the Yankees.
I would say that.
So real quick, before I let you out of here, give me something about the Orioles this year.
I don't know. We're going to have to wait and see.
That's it?
I'm 2 years out. I don't have the inside track anymore.
You don't have the inside track? Okay. For those who are skeptical or cautious, and I say, well, the knee, I get, right? I understand that because it's very common. The hip, I get it's very common. Is this going to become more common as time goes on because more and more people are going to have serious problems and real pain that's persistent and chronic?
I certainly think it will. You know, one of the issues I constantly encounter with the shoulder replacement is people don't know about it. Everyone knows someone that had a hip or a knee done, and they see how great they do, and they want to go ahead with it. The shoulder replacements, not many people know anyone that's even had a shoulder replacement. Some people don't even know it's an option. But as the surgery becomes more common, I think it'll kind of beget more people wanting to have the surgery.
You mean as people know other people who have it?
Yeah, because they'll see how well they do. The pain relief is amazing, and it's almost immediate. Usually I see people a week after their surgery, and 90% of the time they say they have no pain.
What's that like for you?
They take a Tylenol to go to bed. It's my favorite surgery to do by far. People are so happy afterwards. It's far and away my favorite surgery to do. The best patient response.
Well, making a difference in people's lives is a big deal. Dr. Nicholas Jarmon, Orthopedic Surgeon, Meridian Health. I want to thank you for joining us. We appreciate it.
Thanks so much for having me.
Good stuff. Stay right there. He's really at his heart a Yankee fan. No, I'm joking. Stay with us. We'll be right back right after this. Thank you, Nick.
Thank you.